Hi, this is Mark, and this is my prostate cancer experience. I wanted to post a short video on continence and what to expect after you've had a prostatectomy, the removal of your prostate, and after you've left the hospital and after the catheter has been removed, and then you're on your own to resume a regular life. Part of that is being continent, the ability to urinate and control your urination. Now, there's a lot of people out there, a lot of postings you'll see on the internet about people that have had this surgery and complain of incontinence. Their urine comes out liberally when it's not expected. In some cases they regain a lot of continence, but when they cough or sneeze or laugh, sometimes there's some drip and dribble. A lot of stories about people wearing pads and this sort of thing. I was very, very lucky. And I think part of the reason for that is I chose the right surgeon. I chose Dr. David Samadi, based in New York, who performs the surgery at the Lenox Hill Hospital. And he has a procedure developed that really minimizes incontinence. And for me, at least, I came out of the surgery, I had my catheter removed, and I had 100% control incontinence. I'm not even leaking. I don't even have to wear pads. And this is truly amazing because I expected the worst. But to prepare for this, I did work with a trainer for 6 weeks prior to the surgery. I did my Kegel exercises, which are exercises that teach you how to kind of tighten up your inside. So what was the experience after the catheter came out? It's a little intimidating at first, but you have to remember also, when the catheter's been in your body 7 to 14 days, I had mine for about 12 days, the catheter it starts inside your bladder, it runs through your urethra, and then out the end of your penis into a bag. Now, this is a rubber tube. It's a foreign object in your body. Your body doesn't like it, your body adapts to it, but for the whole time that it's in there, it's kind of fighting it a little bit. It's not particularly uncomfortable, but what happens is when it's removed, a lot of the tissue inside your body, both your bladder, both your urethra, and your penis as well at the end of it, it's very, very sensitive. And so what happens the first time that you urinate afterwards, what you're going to notice is, unlike before, when you have your prostate acts as a valve. There's several valves in your system that control urine flow. Your prostate is one of them, the sphincter is another. So now that you don't have your prostate anymore, your sphincter is going to work a little harder, but it works very, very well. So in the past, when you have to urinate, as a male, there's sort of, you're holding it, and then you kind of release it and kind of push it out. There's almost sort of a sensation you have that you're making it happen. You're somehow there's a mechanism pushing it. Well, at this stage with the prostate removed, what happens is the urine, it basically comes out on its own. You're in control, but what happens is, and it's not like you're holding it in, but when you have to urinate, you'll get a sensation. You won't have that same I have to pee sensation that you had before, but you'll feel that there's something ready to kind of happen there. And then when you go to the toilet, basically you look down and you say, let's do it, and you feel yourself letting go, and it comes out very strongly, and it comes out in a nice steady stream. And then when it's finished, you basically say, I'm done, and it just kind of stops again. It almost feels like a mental exercise. You don't really feel yourself kind of pushing a lot. There's a little bit of squeezing that you do, but it's not something that you try to do very much. It's not difficult to do. It's very easy, as a matter of fact. But in the hours that follow the catheter removal, because things are tender, you may find a lot of a burning sensation. And so it's really important not to force it, but just to let it happen. And also to understand, when you feel the burn, just let it happen, take a deep breath. It's going to be with you for a while, and then it will go away. So on that first day, you're probably urinating about every hour or so. Your first night, you're going to be getting up. For me, I was looking at the clock every hour on the hour. I just felt the need to get up and go, and urine came out. Surprisingly, a lot came out. I was drinking a lot as well. I wasn't over drinking, but I was making sure to get my fluids. So basically, that first night was getting up, urinating a little bit, going back to sleep, and then an hour later getting up again. It's not like I was up all night. I could sleep very, very easily. There's a little bit of burning when you do that, but nothing too intense. On the second day, however, you find that you generally can hold your urine a lot longer. So my second night was last night, and I just got up once to urinate. And it seems as every day passes, the capacity to hold urine gets a little bit larger. Keep in mind, after the surgery, your bladder will shrink a little bit. And over time, it will kind of get back to a decent size where you can hold more ounces or more liters of urine. So in the beginning, you may find yourself going a little more often just because the bladder is a little bit smaller. But from my own experience, the burning sensation subsides. It's nothing you can't live without. And any time in this whole procedure, from the surgery to post-surgery to catheter to post-catheter, just keep in mind that there's a small price to pay for a long life. This was all necessary to relieve yourself of the cancer. And so this little bit of discomfort that you may come across, you can live with it. It's not going to kill you. There's nothing medically wrong. You want to make sure that you're checking your urine. It should be clear, it should be yellowish. The lighter the color, the better. If it's a darker color, then you're probably not hydrating enough. But you want to be looking for blood. You want to be looking for little blood clots. For the most part, you're not going to see them. And I was very lucky, like I said, there was very little. If there's a little bit of a pinkish residue from time to time, that's perfectly okay. But the point of all this is that this is something that you'll go through and you'll be very, I want to say, relieved about, not to create a pun, but I just did, I guess. So it's just fine. Life is going to be not too different from this point forward. There are some small adjustments, but you'll be amazed how quickly you adjust to them. I'm delighted and I'm elated at the fact that I don't have to wear guards or pads in my underwear. We'll see what happens in the coming weeks, but as of now, I have 100% control. And I really attribute that to working with the right surgeon. And there are a lot of great surgeons out there, but you really want someone that has a track record for doing this. And I feel like one of my missions now is just to tell people about how great Dr. David Samadi is. And I'm not a paid spokesperson, I'm just a patient who has a new lease on life and who's very happy. And I'm the kind of person, when I hear of something good or learn of something good or work with someone who's amazing, I just can't stop talking about it. So I'll forever talk about Dr. Samadi and the amazing technique he has for surgery. So anyway, that's all for now. Keep watching this video series. I'll be updating it in the days, weeks, and months that follow. And if you're a prostate cancer patient, I encourage you to do your research, but feel free to look me up anytime. My contact information is on my YouTube channel. And if I can help you get through the process, it's my pleasure to do so. So that's all for now. The best to you.